For those of you who know us, I'm Dr. Burkenstock, owner of Skin Body Health in Mandeville, Louisiana, and New Orleans, Louisiana. And we've got some amazing breakthroughs to tell you about this evening, and those breakthroughs are in erectile dysfunction. So many of you who have tuned in to me before know that I always preach, if we're talking about erectile dysfunction, we have to make sure our major health is in order. Well, why? Well, because if you've got high blood sugar or diabetes, if you've got high blood pressure, or even a slightly elevated blood pressure, if you're drinking too much alcohol, if you've got high cholesterol, or if you've got a thyroid disorder, all of these things affect the penile artery. And the penis has one major highway in and one major highway out. Therefore, if you're experiencing any erectile dysfunction whatsoever, whether it's a change in stamina, or whether it's a change in girth, or an inability to keep the organ as hard as you would like it for your intimate relations, that not only is a disappointment in the bedroom, it's also a sign that lets us know you've already got at least some kind of blockage in the heart and the brain. Because the penile artery is going to get clogged before the heart attack, brain, stroke. So it's very, very important to our malehood, and we understand that. But it's also very important to your overall health. So if you're having any kind of issue in the bedroom, by all means raise your hand and talk to your provider. Because there are so many things that we can do today that we could never, ever do before. So one of the things that we want to do is, if you're a smoker, quit smoking, because smoking will cause an increase in erectile dysfunction. Why? Well, the tobacco from the cigarettes is really, the particles are pretty similar in size and shape to cholesterol. Therefore, they will get in there with the cholesterol particles and cause a premature or an enhanced blockage in the penile artery, which none of that is good. We want to quit smoking. We also want to decrease alcohol. So anything in moderation is fine, but alcohol will actually inhibit the muscles and the organs and cause weakness and atrophy in the major muscles that hold up the pelvic girdle and the penis, the bulbospongiosis and the ischiocavernosus. So let's talk a little bit about what some fancier things that we're doing these days for erectile dysfunction and benign prostatic hypertrophy or an enlarged prostate. Well, what we now know and didn't know before, in addition to the cholesterol, the high blood pressure, the sugar diabetes causing problems in the major penile artery, in addition to that, the weakness of the pelvic floor, or those major muscles that hold up the pelvic floor, will cause benign prostatic hypertrophy because there's no support, and erectile dysfunction of the penile organ. So did you know that exercising can absolutely improve, right? So the tighter that pelvic or floor is, the less erectile dysfunction you're going to have. There's exercises that many females know, but not a whole lot of guys may know about it. And that's called the Kegel, K-E-G-E-L, or the Kegel exercises. So if a woman starts with some urinary incontinence where her pelvic floor is getting weakened and she's losing some urine upon sneezing or coughing, we know to tell her to do the Kegel exercises, which is sort of like imagining you're in an elevator. So you take your pelvic floor, you pull it in, you pull it up, let it go. You pull it in, you pull it up, hold it, and let it go. Kind of been a metaphor would be if you're on the toilet and you think someone might be knocking at the door and you stop your urine for a moment. That's actually a Kegel floor moment. So we got this lovely gentleman on the side of me, Dan, and he's actually sitting on the major breakthrough. So this equipment right here is electromagnetic radio frequency stimulation. Well, that's a whole big word, and really what it basically means is it's a chair with electromagnets and radio frequency, and what those chairs do is they contract and cause 11,200 Kegel exercise moments in 28 minutes. So as you can see, Dan is fully closed. This is the end of his 6th treatment. This is his last bonus treatment because we appreciate him coming on today, and no, we didn't rob him, but we're going to hear what he has to say about what this equipment and what this protocol did for his issues in the bedroom. So it's a simple procedure. The electromagnetic waves comes out of the BTL equipment machine, and they're stimulating and pulling and contracting the pelvic floor. All that is needed is to sit on the chair, lean forward so that the pelvic girdle is actually interacting with the magnet on the face of the chair. And you can feel the intensity. It doesn't hurt. It's a pull. You can certainly feel the muscles contracting, and it's sort of an odd feeling at first because the muscles are actually contracting and you're not doing anything, but you feel them working. Afterwards, you can get mild tenderness for maybe 10-15 minutes or nothing at all. It's just not a painful procedure. So along with this is one of our greatest breakthroughs. When we couple this with platelet-rich plasma injections, otherwise known as the P-shot, exosomes, which is a form of stem cells, and we inject those into the penile tissue also. And we just get a home run because we're treating with the PRP and the exosomes, we're creating angioneogenesis, which means the creation of new blood vessels. Well, what makes the penile organ work? Well, it's the blood flow. So if we're getting the blood flow enhanced with exosomes and platelet-rich plasma, then that's part of the home run. Then we're going to retrain the pelvic floor and get it tight and get the muscles tight and get them functioning again, just like you would do weights to get your biceps back to their 20-year-old selves. Same thing we're doing with the pelvic floor with the electromagnetic stimulation. There was actually a study, and it was been published in the magazine or the scientific publication Sexual Health, and when they had impaired coordination, relaxation, and atrophy or breakdown of the pelvic floor muscles, they did the stimulation, and what they have found was in 95 patients, they had a definite p-value, meaning that it was greater than placebo, so it actually did work, and 59% improved with this electrical stimulation. So the population that was tested were all size, all ages. Some of them have diabetes, some of them had high cholesterol, some of them were young, healthy males. So, and it's a new treatment protocol, and as the studies come in, of course, we'll let you know more information. But if 59% of the people responded with any health cause and being on any medication whatsoever, so you've got the sickest and then some of the ones that aren't so sick. We're really excited to see what this and the new protocols do. So we're combining this electromagnetic stimulation with PRP injections, and no, they don't hurt. It takes all of 2 minutes. Exosome injections, proper diet, quitting the smoking, decreasing the alcohol, keeping blood pressure low, keeping blood sugar low, keeping cholesterol low, and you've got a home run. So I'm going to now ask Dan to make a comment. How have the treatments been for you, Dan?
Well, first off, I was a little concerned about how they might feel, but actually, it tickles. It feels good. But it definitely, over the course of the treatments, it definitely improved my performance. Also, an unexpected benefit was I have a stronger urine stream, which I did not expect that. But I can say this, Dr. B just said a whole bunch of things that are way beyond my pay grade. So for guys out there, let me just put it simply. Here's what I tell my friends. Dr. B will help your ED. That's all I got to say about that.
well, thank you, Dan. I appreciate it so much. We do have 2 other guests tonight. Dennis, if you'd stand up and tell us a little bit about how the procedures work for you.
Yes, modern technology is wonderful, guys. I'm much happier now, and my wife is much happier also. I would suggest it's for any man who has an ED problem. It's wonderful. Thank you.
Thank you, Dennis. We appreciate you. And now we've got Mr. Gary.
Yeah, so I just want to say very noticeable, especially on the urinary incontinence part. From the second treatment to the third treatment was a big difference maker, and very noticeable. And been very happy with the results so far, and looking forward to the rest.
Great. Thank you so much for coming. We appreciate you. So if we can ever help you with your erectile dysfunction or BPH, which is prostate enlargement, there are things that can be done now. Science has come a long, long way, and we're here to help. I'm Dr. Burkenstock, owner of Skin Body Health. You can reach us in Louisiana at 985-727-7676. That's 985-727-7676. Our email, info@skinbodyhealth.com. info@skinbodyhealth.com. Send us in your questions. We'd love to hear from you. And don't forget, vitamin D and zinc, you can find them both in our store, skinbodyhealth.com. Vitamin D and zinc are just essential for good male health. Take it on an everyday basis. It's been a pleasure talking with you. And as always, good health, good vitality, and come sit on our M-Cella chair. Let us show you what it can do for you and your love life.